Hi class, my teaching strategy that I would use for fall preventions for the elderly in their homes, I would use the Morse Fall Scale. As a public health nurse, when you enter the patient's homes, it is essential to, do a quick view of their environment. I would instruct my nurses using the scale. You have the first one here. First variable is to assess for history of fall. And if the patient have a history, you would score the patient accordingly. I would assess the patient for readiness to learn, see if the patient has a caregiver who you're going to teach, and you're going to instruct on mobility safety in the house. If there's any hazards in the home, such as stairs. Um, Second, you would assess for any secondary diagnosis, such as is there any illness that's causing the patient to be a fall risk, such as pain, if there's any hip injury, and is the patient being treated for such injury. Third, does the patient uses any ambulatory aid, and you will score accordingly. Here on the fall scale, you have is the patient bedbound? Does the patient use crutches, walker, a cane? Is the patient in a wheelchair? If the patient is ambulatory, does the patient is the patient able to use furniture around the house for assistance? If the patient doesn't have a caregiver, does the patient needs supervision? The fourth is does the patient have an IV or IV access? And mainly is to just set reminders for the patient to be aware that they're attached to an IV. And absent-mindedly, the patient could get up and fall because they forget. Next is the patient gait. You assess if the patient is unsteady. Normally, if the patient needs supervision, there will be a caregiver present in the home, and we need to teach both the caregiver and the patient. If there's a safety issue, is the floor clutter free? Be aware of throw rugs, any water on the floor that the patient could slip. Make sure there's proper lighting, and if the patient needs glasses, to ensure that the patient wears them and wear secure footwear. Lastly is the patient mental status, and it's basically to assess the patient cognitive, physical, and mental status at all times. Most often they're on medication. Is the patient able to prepare their own medication? Are they able to take it? If there's no caregiver, we need to set up reminders or have a family member assist the patient. The goal is to encourage the patient to be safe at all times and to remain injury free by reducing falls within the home.